this taboo around mental health. Let's leave Sushant Singh Rajput aside from the point of view of what happened. Was he a case of a bipolar disorder or not? The bearings on this investigation. Let's leave all of that aside. The point is, if we continue with this coverage, what exactly is happening? In the minds of the people, the years of efforts that has been taken to convince people to come out and speak about mental illness, about depression, all of that effort is being negated, because when you look at this coverage, many people who would be willing to speak up will also feel, no, let me be quiet. Are we doing more harm than good to those mentally ill patients, to those patients who are borderline depression ridden? Remember, many people said, study after study concludes that India has among the highest number of patients suffering from depression in the world. To discuss this further, I have Dr. Harish Shetty. I also have Dr. Amit Malik. In just a short moment from now, we'll have mental health ambassador Neha Kirpal as well. Dr. Harish Shetty is MD Psychiatry at the Dr. L.H. Hiranandani Hospital, and Dr. Malik is founder and CEO of Inner Hour. Thank you so much. Dr. Shetty, let me begin with you first. Would you concur with this conclusion that the more we harp on, the more we talk about whether he was a patient of bipolar disorder or not, and the manner in which we are discussing and debating this on primetime television, we are impacting the minds of all those people for whom it took years and years of conditioning to come out and open up and speak about it. Are we underlining those taboos around mental health?
Well, the mental health movement is on for a very long time. It's accelerating the last few years with Deepika Padukone and others. Years ago, there was a model who harmed herself and passed away, and the print media wrote a lot about it, and there were a lot of copycat suicides. It happened repeatedly again when the print media also showed the news, the building from where people jumped, etc. So what is important in India is the media guidelines, which has been outlined by the WHO and others, and also the National Mental Health Care Act, which also talks about these things, have been conveniently ignored all the time. My plea to everybody is that as of now, 1 out of 7 people are mentally ill in India by the Global Burden of Disease in ICMR, who released the report late 2019. I would plead to every journalist, every human being on this earth to understand that 1 out of 7 would mean 1 in your family, 1 in your extended family. So let's pray and share that. Let's not spread myths and increase the stigma about mental illness. You do not know what's going on there in people who are actually ill. All the same, if anybody is involved in spreading myths which have been there on the media for a very long time, irrespective of this case, you're only hurting your own close relative who will be hit by the same. Correct. So that I think is very important. So I don't think this is a big shock as of now. This is one of those hiccups which you had, and we'll tide over this. People who are working the mental health movement across the country and abroad are aware of this, and they'll continue their work. But my appeal to every journalist is, when you want to shock the audience, you are hurting one of your own close relatives at home.
That's a very, very powerful statement that you have made. And I guess this is a very powerful message to those sections, to those people in a section of the media who look at pictures of people smiling and then, like Sherlock Holmes, detect whether a person is depressed or not. So Dr. Malik, I want to come to you. What would you want to say to all those extremely powerful people with very powerful processors in their mind, doubling up as TV news journalists, who can look at images of people smiling and detect, certify and clarify that this person cannot be depressed?
I think the first thing to really say is that let's not forget the context, right? In this current context, what is really happening is that the need for mental health support has gone up significantly, right? So even on our platform, we're seeing 3x, 4x the number of people who are coming pre-lockdown to seek support. So let's remember that there are a lot of people out there right now struggling with mental health issues. Dr. Sherry talked about the large number in India that already have mental health difficulties. I'm saying that this number has gone up even more significantly in the last few months, right? So let's now remember that context, remember the number of people who are struggling right now, and then think about, are we doing harm or are we doing good, right? And Dr. Shetty's already talked about the reporting responsibly, and that's very, very important because, suicide remains one of the leading causes of mortality in the young population of India, right? So it's not just a statistic. It's a very, very important public health issue. It's a very important tragedy that happens to families when it happens. So let's remember that, and that need is going up significantly right now. So let's remember that when we talk about this, how we report it, how we present it to the public, and especially in this context, it's even more important that we behave responsibly, right? Now, coming to your question, it's very hard without having seen somebody, assessed somebody clinically, having spent time in a clinical assessment with them to say whether they have a clinical mental illness or not, right? So, and sometimes it's hard even then after having done that. So to be able to pass judgment by just some sporadic images or by even short encounters is very, very difficult, if not impossible. Right? That's all I can say. So I think I would say reserve judgment on clinical diagnosis to clinicians. Right? Let them make those decisions when it's required and when the person chooses to subject themselves to that. And remember the context when reporting and talking about mental illness.
Absolutely,
right now.
absolutely. Neha Kirpal is also with us. Neha, I want to ask you this question. Through the course of this entire investigation, many advocates, many people concluded and said that at any point in time, you may be describing an individual in a particular situation or circumstance. When you say that a person is short-tempered, a person is breathing heavily, a person is anxious, agitated, now this could be a frame of mind temporarily, which may not necessarily mean that the person is depressed or unwell or suffering from bipolar disorder. Do you think that we are very casual in our understanding publicly about mental health?
I think it's very important to educate ourselves and educate people around us, especially those who are running organizations, institutions, and there as sort of leading figures in the community. We recognize that neither is suicidal thoughts a permanent sort of occurrence, nor is depression permanent, right? These are treatable conditions, these are preventable conditions. World Suicide Prevention Day is coming up on the 10th of September, and I think it's very important. It's not just the responsibility of public figures and media, but of each one of us to just understand and educate ourselves a bit more and reach out with a level of empathy and understanding and a place of knowing how best. And there are a lot of myths around suicide and around even depression and mental health and the link between the two. So it's important for people to understand, and it's important for people to communicate appropriately.
Dr. Shetty, I want to come back to you. I'm just taking a look at this data released by the National Crime Records Bureau, which has been released only okay, you're showing us some document. You're showing us some document. Would you like to tell us what this is?
The same one, what you are now saying.
Yeah, accidental deaths and suicides in India. That's exactly what I have. This is interesting that we are on the same page on this. Now, I'll take a look at this report and let's quickly put those graphics also of the causes of suicide, death by suicide in 2019. No, the other one. I'll request the producer to put the other slide. The causes of death. Family problems, no, the pie chart. Family problems at 32.4%. Illness 17, drug abuse at 5.6, marriage related 5.5, love affair 4.5, professional and other issues 24.5, and causes not known 10.3. So, family problem and professional and other issues combined are a major contributor to a person developing suicidal tendencies and then going ahead with a death by suicide. Dr. Shetty.
Yeah, I see that inside the family, the emotional contact time has gone down, the family contact time has gone down because of globalization, rapid change, and so many things happening inside the country. So there's no time to share feelings in the last third phase of the industrial revolution. So disconnection is the biggest disease. Disconnection is worse than HIV. And what is very important for us to understand that we need to work towards reconnection. At the same time, we need to understand that we can't wait for those at high risk to be doing something. We need to identify high risk people and really give them a lot of relief. So there's a lot of issues inside the family, relationships, could be jobs, they also could be issues with teenagers. And unfortunately, the causes of suicide in India is not recorded as well as it is done abroad, because the police and the family members who report, there's no mental health professionals. So, but I think I would say the best available data is important for us to understand that family mental health is the key to good mental health and to prevent suicide. Also, one part of the data is 1 out of 5, more than 1 out of 5 people who end their life by suicide are daily wage laborers, and that is very important. 1 out of 6 are housewives, and that I think is these two important aspects of this entire data is so important. We need a mental health movement. I'm not saying this. The president of the country 2 years back said we are in the middle of a looming mental health epidemic. So we need mental health ministers at the center and the state. We need to take mental health as important as physical health. Health workers who go and screen for COVID, TB, malaria should be trained to screen for suicidal thoughts so that this can be prevented. Mental health science is not rocket science, not in philosophy. It's something we can do very easily. So we need to have a mental health movement across the country.
No, but then what happens to the little pace that the movement gathered, Dr. Malik, when you hear about the stories and the manner in which they are presented? I ask you this question again and again because there also now seems to be a parallel movement to discourage people that no, this person is not a mental health patient. In fact, he or she is being made out to be a mental health patient. I want to ask you that under normal circumstances, how does one be convinced whether a person is a mental health patient or not? Because it will be very easy for someone to look at snatches of my conversation or snatches of my behavior to come to a conclusion.
I think my broad view, and I say it very plainly, is that frankly it's a matter for the person and their treating clinician as to whether they are mentally ill or not, right? And then and their extended support system, whatever that might be, right? So frankly, this is a very personal issue, right? And respecting that personal space, respecting their individuality, so that people feel comfortable that they will not be judged or vilified for seeking support for a very difficult, at a very difficult time in their life when they're experiencing mental illness is very, very important, right? And so the request to everybody out there, and Neha talked about this, the request is to everybody out there, not just to media or to anybody else, is to really respect people's space and boundaries, allow them the safety of and the safe space.
No, but then what about those people? What about those people, Dr. Malik, who have succumbed to mental illness? And I'm not going to say this with great conclusion because this is a matter in dispute as of this moment. But for instance, the case of the matter of Sushant Singh Rajput, where the family says that no, there was no mental illness. And then on the other side, you have people who say that yes, he was being treated for a bipolar disorder.
Listen, I'm really, Sanket, I have really no idea about, and I cannot comment on an individual case.
No, don't comment on the individual case. One moment, let me ask this question of Neha. Neha, my question is not about the individual case. My point is, what happens in cases where you put the position of someone being a mental health patient in dispute? Then what happens? Is this not disservice?
So let me step back and just slightly broaden and perhaps correct the question itself, right? Because you're assuming that there is a lot of people who have mental illness and then there's a lot of people who have mental health, right? And what is important to understand when we talk about really understanding what the problem is and what the solutions are, is recognizing that mental health and mental illness is a continuum, and different people at different stages in their life could be at a certain point. So one day I could look like I'm chronically depressed and having suicidal ideations, and 2 months later I could have worked on myself with therapy, I may have taken some medication, or I may not have such a severe bout and I'm over it and I'm the most joyous person. So it's important to recognize that
no, I've heard, Neha, from a lot of friends, I have heard that you know, many of the psychiatrists, many doctors advise exercise or meditation. People don't even need medication. Meditation is also going to help in of course, mild cases.
So, you know, for something as complex as the mind, there are so many dimensions to it, and there are so many layers towards what your clinical diagnosis is and what your psychosocial, behavioral, and environmental situation is. Mental health is one of those things where all these things feed into making it worse, and all of these things contribute as factors to making it better. So there is no fixed formula to say that this much medication for this particular bipolar or schizophrenic or depressed patient will help to this extent. It's a combination of factors. And that intangible, non-specific aspect is what confuses people. Because people are not sure then what they can ascribe to as the real problem.
Correct.
And how do they measure the recovery,
Correct.
right? Having said that, suicide and severe mental health conditions don't happen overnight. These are progressive conditions. They set in very early.
And they are chronic.
Even at age of 50. And they are progressive, but they're also treatable. Okay. Why aren't we carrying the message of cure and treatment and giving people hope?
Well said.
That the first step is really the admission of the problem and seeking help. Because when you do that, the journey becomes a lot easier after that.
Well said, well said. Thank you so much, Dr. Shetty, Dr. Malik, as well as Neha Kirpal. And towards the end of the show, I just want to repeat and highlight for all those geniuses who can look at a picture and conclude that a person is a mental patient or not. Every time you report the way you do, you may be affecting someone in your own family or someone close to you, because in India, statistics show that 1 in 7 people could be affected or victims of mental health. Think about it. Good night and goodbye.